Here in Nashville, Tennessee, we have, school resource officers, SROs, right? We don't have the amount of counselors that we need per ratio in our public schools right now. How would the insertion of more resources, more funding, maybe to therapists, maybe to counselors around that social emotional learning, and maybe instead of school resource officers, how would that benefit? Some people don't even like the idea of youth being around police officers in school, especially the population of people of color, just because of the historical relationship between police and community. But can it be an and both?
This is a complex topic, right?
Yeah. That's why we got you here to unpack it for us a little bit.
If we really wanted to address youth mental health, we would have a mental health services infrastructure that is independent of the school system.
Okay.
Right? It's kind of like a network of care focused on our mental health outcomes as a nation.
Right.
That would happen well before our kids get into school. Our brains are about 80% developed by the time we are 3 years old.
Right.
Yeah, and so what's happening from 0 to 3?
Right.
And people don't want to talk about that because we believe that this is the family business, is individual responsibility. But when we think about childhood trauma and lack of attachment in the home, just imagine if, I used to work with juvenile offenders, right? And if we think about a lack of a mother's love or lack of attachment with your caregiver, and that's the main driver for someone of a young age being able to pull a trigger on someone else. It is a lack of empathy that is instilled through the way that they are raised.
Right.
And the way that they are raised is impacted by the larger society.
Right.
So if we live in a racist society, if we live in a society that allows poverty to be at a crisis level, if we allow for families to be under the weight of poverty, racism, and all the things that come along with kind of this system that we have, then of course we're going to have children who have mental health issues, and it's adaptive.
Right.
It's not, we talk about mental health like it is a perversion of the human experience. Our mental health is a reflection of our environment.
Right.
If our environment is poor, then our mental health will be poor. And we will employ tactics to ensure our survival. And I have to be pretty cold-hearted to survive in poverty. I have to teach my children or prepare them to experience racism when I live in a racist society. And that is the issue that we need to address if we want to address youth mental health. And we're not prepared to do that at this time.